Good morning. Good morning and welcome to the University of Minnesota School of Public Health Roundtable on Health Disparities and Improving Access to Mental Health Services, the Affordable Care Act. I'm Beth Virnig, and a professor and senior associate dean for academic affairs and research at the University of Minnesota School of Public Health. I'm delighted to be here to talk with all of you and to be part of this amazing event. To many of you, I should say, welcome back, since you've attended the Health Disparities series for a number of years. For those of you attending for the first time, I'm confident that you'll find this morning's presentation and ensuing discussion stimulating, thought-provoking, and at times perhaps frustrating as we continue to examine more closely the complexities of health disparities. So today is a day of sharing our collective research, insights, and perspectives as we attempt to more fully understand and seek effective, sustainable solutions to this urgent topic. An event like this takes time and teamwork to plan and deliver. Please join me in a round of applause for the organizing committee of faculty, staff, and students from the School of Public Health, the Health Disparities Work Group, the Center for Leadership, Education, and Maternal and Child Public Health Training Grant, the Midwest Center for Lifelong Learning in Public Health, and the Medical Schools Program in Health Disparities Research. Thank you very much. Today's topic, improving access to mental health services, the Affordable Care Act, is truly a timely topic for several reasons. First, starting this year, the Affordable Care Act will provide one of the largest expansions of mental health and substance use disorder coverage in a generation, by requiring that insurance plans on the health insurance marketplace cover mental health and substance use disorder services. Our speakers today will discuss the strengths and limitations of the Affordable Care Act in achieving this laudable goal. Second, the School of Public Health is in the middle of a strategic planning process, and we are looking forward to what the world will be like in 2030. What will the world be like 15 years from now? 17 actually, and we, as part of that, polled our faculty and said, what are the most important topics that will be facing the world in 2030 so that we as a school can begin to prepare to make sure we are positioned to help find solutions for those. And two of the topics that made the top 10 were health disparities and mental health. And this topic today actually combines exactly those two issues, these two issues that are not only important today, but that we expect will still be important for all of us 15, 20 years from now. So I am thrilled that this work is going on because it very much feeds into the absolute top priorities for our school. I now would like to introduce our moderator for today's event. It's Ezra Goldberstein. He's an assistant professor in the Division of Health Policy and Management at the University of Minnesota School of Public Health. He's a health economist and health policy researcher, and much of his current work focuses on mental health services, and policy. Frankly, he's one of the few mental health economists in the country, and that is a very unique perspective that is going to be increasingly important. Prior to starting at the University of Minnesota, he was a National Institute of Mental Health postdoctoral fellow in mental health economics and policy in Harvard School's Department of Healthcare Policy. I'm sure you'll agree with me that he's a wonderful addition to our faculty and that we're lucky to have him, and you will very much enjoy him today. So thank you very much.
Thank you, Beth. That's a very, very nice introduction. So I get the pleasure of introducing our speakers today. But first, I just want to note, so as you registered this morning, you should have received a program for today, and included in the program is an evaluation form that we'd like you to complete at the end of today's event, and an index card as well. Please write down a question that you'd like to ask the speakers on your index card, and we'll come around and collect the cards. If you don't want to do that, you also will have the option of directly asking a question of the speaker. We'll have, I think, people with microphones available as well. So let me go right ahead and start introducing our three distinguished speakers. The first will be Howard Goldman. Dr. Goldman is professor of psychiatry at the University of Maryland School of Medicine. Dr. Goldman's expertise is in evaluating mental health services and financing programs and policies. He was the director of the Network on Mental Health Policy Research, funded by the MacArthur Foundation. He has also served as the principal investigator on really very major and I would say landmark work understanding the effects of mental health parity policies in the context of the federal employee health plan that has been really quite influential as parity has become really a national policy priority. As someone who is very excited about mental health services, the editor of one of my favorite journals as well, Psychiatric Services, which is really required reading for everyone, in my opinion. Our second speaker is Dr. Veronica Svetas. Dr. Svetas is a family practice and adolescent health physician at Hennepin Family Care Eastlake. She was instrumental in creating the Aki Parati Youth Development Clinic for Latino adolescents and their parents. In 2001, she participated in drafting the consensus statement on healthcare transitions for young adults with special healthcare needs, which has now been accepted as policy by the boards of the American Academy of Pediatrics, the American Academy of Family Physicians, and the American College of Physicians and American Society of Internal Medicine. She's board certified in family practice and adolescent medicine and is an assistant professor here in family medicine and community health at the Minnesota Medical School. Our final speaker is Sue Abderholden. Sue is the executive director of the National Alliance of Mental Illness Minnesota. Sue is a very active advocate for people with mental illness at the state, local, and federal levels. Most recently, Sue has been a mainstay at the Minnesota Capitol, meeting with legislators and committees to introduce 12 bills focused on improving children's mental health services. I would also be remiss if I didn't note that Sue is one of our most distinguished graduates from the School of Public Health. She came out of the Public Health Administration and Policy Program and was a recipient of the 2013 Gaylord Anderson Leadership Award from the School of Public Health. So the format for today is we will have our three speakers in order, followed by some discussion. I will give both the audience and the speakers a little bit of warning, though. After each of the presentations, while we're transitioning to the next speaker, I will ask one question to sort of follow up on the discussion and really hopefully start getting our discussion juices flowing a little bit.